dealing with the CSF findings. In CSF findings, the normal findings, bacterial, viral and fungal meningitis, the different parameters. The pressure we have already discussed. Then the appearance, it's the CSF finding, normally it will be normal. Then in bacteria that will be turbid, and in viral that is clear. In fungal that will be fibrin web will be there. And the protein that is normal is 0.18 to 0.45, and in bacterial that is more than 1, and in viral it is less than 1, and in fungal that is 0.1 to 0.05 will be the range. Then glucose that is 2.5 to 3.5 is the normal, and in bacteria that will be low, that is less than 2.2. Then in viral it will be normal, and in fungal that is 1.6 to 2.5 will be the range. Then gram strain, normally no changes will be there. In bacteria that is 60 to 90% positive. In viral that is normal, and fungal no specific changes. Then in glucose CSF serum ratio that is 0.6 is normal, less than 0.4 will be there in the bacterial, more than 0.6 will be in the viral, and in fungal that is less than 0.4. Then the WCC that is will be less than 3 is the normal, and more than 500 will be in the bacterial case, and in viral that is less than 10,000, and in the (100 to 500 will be the in fungal case. Then coming to the complications, that is sensory neural hearing loss, then epilepsy or seizure will be the memory loss, paralysis, then learning difficulty. These are the main complications: sensory neural hearing loss, epilepsy, seizure, memory loss, paralysis and learning difficulty. Then behavioral difficulty will be the decreased intelligence will be the septicemia and death. These are the common complications of meningitis. Once more, the sensory neural hearing loss, then epilepsy or seizures, memory loss, paralysis, learning difficulty, behavioral difficulty, decreased intelligence, septicemia and death. Then coming to the medical management. In case of bacterial meningitis, third generation cephalosporin such as the cefatoxim or the ceftriaxone is the drug of choice, and we can use the vancomycin in cases of the resistance. Once there is a resistance in the organism, then we can use the vancomycin. Then dexamethasone, then dehydration and shock can be treated with fluid therapy, and the phenytoin for seizure management or seizure precaution we will be using. Means in case of meningitis we are suspecting for a seizure episode, so we can use the phenytoin in advance also. Then the tubercular meningitis, there is a ATT medications are started, that is anti-tubercular medicines will be started in case of tubercular meningitis, and the medicines include hope you know regarding the TB medicines, that is isoniazid, rifampicin, pyrazinamide and the streptomycin. Then the second line drugs we can use, that is the aminoglycosides and the fluoroquinolones. Then the conventional therapy is given for 6 to 9 months. Means as a case of TB, how we are treating, just similar to that itself, we have to treat the specific case of the tubercular meningitis. And in children, the BCG vaccine offers approximately 64% protective effects. Means once we are getting the BCG vaccine, then we have the capability to resist the tuberculite. Then the viral meningitis, the treatment is mostly supportive and no medicines are prescribed, and seizure prophylaxis can be given, and the lorazepam or the phenytoin or barbiturates is the drug of choice. Then increasing the ICP means we have to give the injection mannitol 1 gram per kg followed by 0.25 to 0.5 gram per kg quarterly 6th hourly, or an dexamethasone we have to give. Means once we are giving the mannitol, that will be helping to reduce the cerebral edema, and in turn that will be helping to reduce the increased ICP, and that will be helping to maintain the normal ICP, and we have to advise the rest also. These are the things in the viral meningitis. supportive and supportive treatment is the main thing, and we have to give the seizure prophylaxis, and we have to reduce the ICP. These are the main things in the viral meningitis. Then in case hydrocephalus is present, means we have to do the ventricular peritoneal or the VP or LP shunt. We have to that is required. Then means for the cerebrospinal fluid will be diverged, and that may be collected to the peritoneum. Means from the from the brain we will be draining the fluid into the peritoneum, and there will be a nice cannula like catheter will be there in the just below the skin, and we can in case of a patient with the VP shunt, we can easily identify that shunt in such patients. Then adequate hydration is to be maintained, and antipyretics and antiemetics, means as per the symptoms we have to give the specific treatment. So these are the main things regarding the meningitis. Hope it's clear.